Hey everyone, I just did my first video yesterday and I decided to do another one mainly because I'm bored and yeah, and also I forgot to say some things last time. So today is Sunday and I am technically due tomorrow, although I like calling it a guest date rather than a due date. Anyways, I have some books here that I wanted to share with you. So I mentioned a little bit in my last video about the idea of having the birth as gentle as possible for the baby, and a really good book about that whole philosophy is called Birthing Without Violence by Frederick Laboyer, and it's very interesting. It's just basically about how instead of assuming that birthing should just be just kind of a medical process to get the baby out, and that you should kind of consider maybe the baby's perspective and how it feels to be born, which is, when this came out, it was kind of a radical idea to consider that a baby would have feelings and to even consider the baby's perspective. So anyways, he kind of proposes that maybe babies feel a bit of a shock coming out because they're going from darkness to brightness, especially in hospital, all those fluorescent lights and everything, from warmth to cold, from muffled noises to all of a sudden they're out of the liquid, so sounds must be pretty intense, from never having too much rubbing on their skin to being manhandled and put on metal trays and all this stuff in hospital. So he basically proposes keeping things as gentle as possible, so dimming the lights, keeping voices down as much as possible when the babe is born. I want to show you a really cool picture though. Hold on. Oh, here it is. So this baby was just born, I think it was a couple hours earlier, and it's already smiling. And it was thought that babies couldn't really smile, like truly smile, for a few months after birth. But it looks like that baby is genuinely smiling, and that was a very relaxing, gentle birth. Another really amazing book that has been really great throughout pregnancy is The Wise Woman Herbal for the Childbearing Year by Susan Weed. And basically this is just full of various herbs for basically anything you can imagine that could be troublesome during pregnancy or childbirth or even postpartum. So there's things for preeclampsia, or what? I don't even know how to say that. Just basically things for alleviating sleeplessness, morning sickness, making sure that you've got plenty of iron and other minerals, and it's just things for diaper rash, things for cracked nipples, just anything you can imagine. There's something natural and easy to make that will help you. Another really great classic is Spiritual Midwifery by Ina May Gaskin, and this one is kind of funny. It's pretty outdated. It's from the 70s, but anyways, it's very interesting. It's a bunch of I guess hippies in the 70s who went around in an entourage of buses and basically lived in buses, and all these women started giving birth. This woman, she was kind of the official midwife of the group, and yeah, she just kind of had to learn birthing as she went along, and became an expert. And basically the whole approach of this book is just that birthing is a beautiful, wonderful thing that doesn't need to be medicalized. And yeah, I found this really funny and good, and it gave me a new perspective of birthing that I didn't have before. The other thing I wanted to talk about, I'm over 10 minutes, anyways, I wanted to talk about diapering, and I'm not going to diaper my baby. We are doing something called elimination communication. Well, that's the word given for it. I don't like that term at all. I like, why does everything have to have a name? But anyways, that's what it's called if you wanted to look it up online or something. Or it's called going diaperless, or natural infant hygiene, I think is another word. So basically, I was given a whole bunch of cloth diapers, and we're going to have those as our backup because especially in the first few weeks, it seems that you would have your baby in diapers, and then when you find that the baby's wet, you change the diaper right away, and it's a lot easier to feel that when they're cloth diapers. And then basically you gradually learn your baby's cues. Hold on, someone's calling me. Anyways, what was I saying? Oh yes, the idea is that you will gradually learn your baby's cues and your baby's rhythms, and know that, okay, usually 5-10 minutes after I breastfeed, my baby's gonna go pee. And it's not like this thing that you want to put a lot of pressure on yourself with. If you miss pees, that's fine, but for myself, I'm doing this as a sort of way to try to read my baby. And I was traveling in Southeast Asia and noticed that babies there just don't wear diapers, and I assumed, being very ignorant, I assumed it was because they couldn't afford diapers. But upon really paying attention, I noticed that these mothers just knew when their babies had to go, and they would hold them over a piece of grass, over a bucket, and they were just so in tune with their babies. It amazed me. So I looked more into it, and apparently this is just the way many women all over the world do it. And I even read this thing where a woman went traveling to somewhere in Africa, I forget where, but a Westerner woman was saying, "Oh, how on earth do you know when your baby's gonna go?" And this woman was appalled that any woman wouldn't know when her baby has to go. Anyways, I thought that was interesting. Not that it should be this big pressure or anything to read your baby so well that you know exactly when it goes, but it's just interesting that that's possible, and so we're gonna give it a try. But anyways, that first week of all that meconium stuff, I don't really want to scrub that off of cloth diapers, so we do have some disposable diapers for probably the first week or so. And then after we've got cloth diapers, I just want to show you these cute little diaper covers. We got a few of these at my baby shower. So these we will use for however long. We may just keep them as backup and then pass them on to someone else. But yeah, anyways, I don't know too much about the practical stuff with elimination communication because I've never been there and I've never done that. So if anyone out there knows more about it, I'd love to learn more. I am a member on the Yahoo group for elimination communication, so I've been kind of listening in to people's conversations, and it seems most people are dealing with, infants I don't even know if they're infants, but you know, a year old or more. So I feel kind of lost in how to even go about trying to go diaperless with a newborn. So anyways, any advice would be much appreciated. And that's pretty much all I want to say now. I guess I'll show you my belly because I forgot to last time. So, there it is. Yep,